Hello, my name is Maria and today I'm going to present my portfolio video. I would like to start by reading the journal article, which is the Reduced Alcohol Consumption During the COVID-19 Pandemic, analysis of 17,000 patients seeking primary health care in Colombia and Mexico. So let's continue with the reasons of choosing the argument. First of all, the topic is cross-cultural, so that means that the analyses were done in two different countries. It is relevant to the current COVID-19 pandemic. There is also behavioral changes. Basically, in Colombia and Mexico, these countries present a really high rate of alcohol consumption. So it is quite interesting to know why suddenly these changes in alcohol consumption. And then also the countries where the analysis was done. This kind of analysis, they were previously done in countries like in America, Europe, and Asia, but never in Latin America. So this journal article is focusing to a study just in Latin American countries. Also, as native of Colombia, personally becomes more interesting. Let's move on to the key argument ideas. So first of all, the reductions in alcohol availability and affordability. As one of the government laws in order to reduce social activities, they increase the alcohol taxes and the alcohol sales. So buying alcohol becomes really expensive and no everyone was able to afford to get alcohol. There is also the reduced opportunities for social drinking during the pandemic. As you know, the government laws in order to reduce social activities. They closed the bars and restaurants, and even though when these places were reopened, they had a really limited capacity. Also, the average decrease by alcohol consumption in Colombia was by 19% and Mexico by 15%. Let's move on to the limitation and strength. So, firstly, limitation. The study was conducted during a short period of time. As mentioned before, this journal article it's focused mainly in the COVID-19 time. So it's very difficult to know if the alcohol consumption percentage keeps the same or it changes. So it's a really important limitation. Also, that is self-reported data. So that means that it's very easy to manipulate or to change these kind of results in order to give bias findings or results. So it cannot be like 100% sure that the results are accurate. However, there is also a strength, which is this journal article is one of the first studies to investigate the impact of the COVID-19 pandemic on alcohol consumption in Latin America. Also, that the study used a large sample size of collected data. As mentioned before, they studied around 17,000 patients in Colombia and Mexico. As a conclusion, the article findings suggest that the COVID-19 pandemic might have led to a reduction in alcohol consumption in countries such as Colombia and Mexico. Thank you for your attention, and here are my references. Thanks.